Hi, I'm Dr. Kevin Haney. I'm the owner of Ozark Regional Vein and Artery Center. Today we're going to talk about what to look for when picking a vein specialist. I guess the first question would be, how do you know if you want to go to somebody to treat your veins or not? The first question I would ask them is, how long have you been doing it and how often do you do it? There are a lot of people who dabble in veins, and they'll do 4 cases every 8th Friday. Well, I would argue I'm going to be a little bit better at it when I do it every single day. When I come in, I'll do 20 or 30 cases every single day than somebody who does 4 cases every 8th Friday. So I think you want to know, how long have they been doing it? What kind of results are they having? What kind of training do they have in doing veins? And where do they spend the majority of their time? If they're spending the majority of their time doing something else and they dabble in veins, then you may be better off to go somewhere where they do just veins. Why would you trust me over someone else? My training was in radiology. So I spent 4 years every single day with an ultrasound transducer in my hand, scanning kidneys and uterus and ovaries and veins and arteries and all the different parts of the body with an ultrasound probe, and doing procedures on people by guiding my needle with an ultrasound probe. So that's what I was trained to do. I did that for thousands and thousands of hours in my training, and now in my 26 years of practice, I've done many, many, many more thousand hours of training holding an ultrasound transducer and hitting something really tiny with a needle. So I think being precise, being well-trained how to do things with ultrasound guidance and be able to hit a tiny, tiny little vessel or a tiny, tiny little certain spot sets me apart as someone that's going to have better outcomes and less complications and less pain. If you need to get your veins fixed, a single tool is rarely the best thing for every single person. Many of the folks who dabble only have a single tool. They'll just do radiofrequency ablation. It's like taking your car to a mechanic and the mechanic saying, I have 1 wrench and I'll fix your car. I don't care what's wrong with it. That's not going to work. So if you have a full menu and you can do everything in the toolbox that is out there, some cases a radiofrequency ablation may not be appropriate. Maybe they need that, or they need a laser of a little crooked segment, or maybe they need some varithena of big bulges that are too shallow or too crooked to put a radiofrequency catheter in. Maybe they need glue. Glue is a great option for some people. Or maybe they just need to have the bulges that are on the surface removed and just pull them out. There's many options that we offer. So everybody that walks in thinking they need a vein specialist doesn't indeed need a vein specialist. Sometimes they'll come in and maybe their veins are fine and you cannot feel pulses, and really they have an artery problem. We've seen that recurrently over the years of solo practice. That situation, we've had to find some place to send them where they know they're going to be taken care of on the level of care that we give. Now that Dr. Stout has joined our practice, we'll have an arterial division as well. So if we find that it's not veins and it's arteries, we can get you over to Dr. Stout. He's going to find a lot of people that come in for artery work that really have vein problems. And so having a one-stop shop where we're going to figure out what's the root of your symptoms and we'll get you the appropriate person is going to really help your healthcare overall and use your time more efficiently.